Welcome to this experts class on vaccines and vaccination. My name is Dr. Jen Olanday, a virologist with interest on highly infectious pathogens and its control. I'm currently affiliated at the UP National Institutes of Health and the Department of Medical Microbiology at the UP College of Public Health. Joining me is Dr. John Mark Velasco, a research faculty of the Institute of Molecular Biology and Biotechnology and the Clinical Associate Professor of Epidemiology. He is a physician-scientist specializing in emerging pathogens, clinical trials, and epidemiology. We're both from the Medical Sciences Division of NRCP, and most importantly, we are both vaccinated. To start off, we'll give you an idea on the types of COVID-19 vaccines and vaccine platforms which are currently available or are being developed. Scientists around the world are developing many potential vaccines against COVID-19. Currently, there are around 90 vaccines being tested in clinical trials among humans, and 30 candidate COVID-19 vaccines have reached phase 3 clinical trials. On top of that, at least 70 preclinical vaccines are under trials in animals. All these vaccines are designed to teach the body's immune system to safely recognize and block the virus that causes COVID-19.
Currently, there are several different types of potential vaccines for COVID-19 which are in development, some of which already have an emergency use authorization from health regulatory bodies, such as the Food and Drug Administration. One type of COVID-19 vaccine is an inactivated or weakened virus vaccine. So this type of vaccine uses a form of virus that has been inactivated or weakened so it doesn't cause disease or replicate in the body, but still generates an immune response. Another type is what we call the protein-based vaccines. This vaccine delivery platform uses harmless fragments of proteins or protein shells which mimic the COVID-19 virus to safely generate an immune response.
A third type is the viral vector vaccine. This delivery platform uses a proven, safe virus that cannot cause disease among humans, but serves as a platform to produce coronavirus proteins to generate an immune response. The last type, which are the newest platform, are the RNA and DNA vaccines. This is the newest, cutting-edge approach among all the vaccine platforms. This uses genetically engineered RNA or DNA to generate a protein that itself safely prompts an immune response.
The first generation vaccines that are currently being used have all been granted emergency use access by the World Health Organization and by national regulatory bodies. Newer and better second generation vaccines are in the development pipeline and will be available once they pass the safety and efficacy criteria set by regulatory authorities. What is important to emphasize is that these vaccines have been proven to be safe in large phase 3 multi-country clinical trials involving tens of thousands of humans. Adverse events are expected, as with all vaccines and drugs, and severe adverse events as a result of being vaccinated are very rare relative to the total population given the vaccines. And severe adverse events have been reported in only a few persons who have been given the vaccines. Vaccine hesitancy is high in the Philippines, and many Filipinos are not yet fully convinced of getting themselves vaccinated. So what really are the benefits of getting vaccinated?
The COVID-19 vaccines have been proven in large clinical trials to produce protection against the disease. This protection is a result of our bodies developing an immune response to the SARS-CoV-2 virus. If you have developed immunity through vaccination by any of the EUA-approved COVID-19 vaccines, this means that you have reduced risk of developing the illness, and most importantly, you are protected from severe illness and death. This immunity helps you fight the virus if you are exposed. Getting vaccinated may help protect people around you, such as your coworkers or family, because if you are protected from getting infected and from developing symptoms of the disease, then you are less likely to infect someone else. It is also important to stress that you get vaccinated with whatever vaccine is available. Doing so will lessen your chances of getting infected and getting the severe form of the disease. Real-world effectiveness trials have also shown a much higher protection compared to the protection reported in the phase 3 clinical trials. So hopefully, we have now convinced you of getting vaccinated. An important part of vaccination campaigns is herd immunity. But what exactly is herd immunity?
When someone is given any of the EUA-approved COVID vaccines, they are very likely to be protected against being infected. But not everyone can be vaccinated. Some people with health conditions such as HIV or cancer, or those health conditions which weaken their immune systems, or those who have severe allergies to some vaccine components may not be able to get vaccinated with certain vaccines. These vulnerable people can still be protected if they live in and amongst others who are vaccinated, since the vaccinated persons around them would form sort of a wall or a barrier which will protect the vulnerable members of the community from being infected. When a lot of people in a community are vaccinated, the pathogen has a hard time circulating because most of the people it encounters are immune. Thus, it cannot efficiently spread and be transmitted. So the more that others are vaccinated, the less likely people who are unable to be protected by vaccines are at risk of being exposed to the harmful pathogens. This is herd immunity. No single COVID-19 vaccine currently available provides 100% protection, and herd immunity does not provide full protection to those who cannot safely be vaccinated. But with herd immunity, these vulnerable people in the population will have substantial protection, thanks to those around them being vaccinated. Vaccinating not only protects yourself, but also protects those in the community who are unable to be vaccinated. Again, it is very important to get vaccinated with whatever vaccine is available. The more people that are vaccinated, the faster we can go back to our routines before the pandemic. Now that you have received a COVID vaccine, can we stop implementing non-pharmaceutical interventions and precautions, such as wearing of masks or social distancing after being vaccinated?
Vaccination protects you from getting seriously ill and dying from COVID-19. For the first 14 days after getting vaccinated, you do not have significant levels of protection, since your body is still just learning to recognize the virus, after which it increases gradually. For a single-dose vaccine, immunity will generally occur 2 weeks after vaccination. For 2-dose vaccines, both doses are needed to achieve protective levels of immunity, which is usually attainable by 3rd week after the 2nd dose. Thus, it is important to complete the required number of vaccine doses and to come back for your succeeding vaccine doses on the date specified by your healthcare provider. While the COVID-19 vaccine will protect you from serious illness and death, we still don't know the extent to which it keeps you from being infected and passing the virus on to others. Initial studies suggest that vaccination decreases the viral load significantly, leading to less viral particles leaving the body, thus decreasing the risk of infecting others. However, to help keep others safe, especially the vulnerable, continue to practice minimum public health standards, maintain using masks, and keep at least a meter distance from others. Limit time in enclosed, crowded, or poorly ventilated spaces. Always follow guidance from your local authorities based on the situation and risk where you live.
We have invited today a guest speaker who will talk to us more about vaccination. Dr. Melvin Sanicas is a physician scientist with over 10 years of international experience in clinical research and development, scientific and regulatory affairs, and program management of vaccine development in the Asia-Pacific, Europe, Latin America, and Africa. He's a Bill and Melinda Gates Global Health Fellow and a global thought leader supporting the United Nations and the World Health Organization to directly counter fake news. He's a global medical director for Takeda, a TED educator, and digital health expert for the WHO. He is also a fellow of the Royal Society of Tropical Medicine and Hygiene and Royal Society for Public Health. Good morning, Dr. Sanicas. We are honored to have you here today, and thank you for accepting our invitation to be our guest speaker in this program. As the vaccination campaign picks up speed here in the Philippines, we have been seeing increasing cases of breakthrough infections among vaccinated individuals. Can you define breakthrough infections and how they can affect our ability to achieve herd immunity?
Breakthrough infection is a case of COVID in a vaccinated individual after getting full dose of the COVID vaccine. But because the vaccine requires about 2 weeks to become effective after the second dose for a 2-dose regimen of a vaccine, a person is not considered fully vaccinated until 2 weeks. A person who tests positive for COVID between the first and the second dose for a 2-dose vaccine, or a person who tests positive before the 2-week period after the first dose of a 1-dose vaccine, is not considered a breakthrough case. The COVID-19 vaccines currently available have proven remarkably safe and highly effective thus far. But since no vaccine is perfect and no vaccine offers 100% protection against infection, we expect to see occasional infections after full vaccination. But these infections are mild and they do not threaten our goal of reaching population immunity.
Thank you, Dr. Sanikas. As a vaccinologist, you will be familiar with the high vaccine hesitancy rates in the Philippines. Can you further elaborate what is vaccine hesitancy and what are the methods how we can counter vaccine hesitancy?
So vaccine hesitancy is the delay in acceptance or refusal of vaccines despite availability of doses. Now, it's important to highlight this because we always hear about vaccine hesitancy in the context of COVID, but in reality, in many places globally, including the Philippines, there are no vaccines available for everyone who wants to get vaccinated. So this must be taken into consideration. But at its core, vaccine hesitancy results from decision-making process and reflects a variety of factors. There are 3 C's. We call them the 3 C's of vaccine hesitancy: confidence, complacency, and convenience. Vaccine confidence is the trust that patients, their families, and the healthcare professionals have in vaccines and the process that led to vaccine development, licensure, manufacturing, and recommendations for use. Vaccine complacency exists when the perceived risks of the disease is low and vaccination is not thought of as a necessary prevention for COVID. Convenience is related to the availability, affordability, and accessibility of vaccines. So these 3 C's, confidence, complacency, and convenience, need to be addressed to increase trust in vaccines and eventually improve vaccine uptake. All of these 3 C's are susceptible to misinformation, and false information affects our decision-making to get the vaccine or not. So to address misinformation, we need accurate, timely, consistent, and empathic messages coming from the authorities, and the government needs to help community leaders and engage them to get the message across the broader community.
So once we are able to counter vaccine hesitancy and a majority of the population agrees to receive the vaccine, is there a specific percentage of the population which needs to be vaccinated to reach herd immunity? And what other factors do we need to consider?
Herd immunity, also known as population immunity, is the indirect protection from an infectious disease that happens when a population is immune, either through vaccination or immune through natural infection. To safely achieve herd immunity against COVID, a substantial portion of a population would need to be vaccinated to lower the overall amount of virus circulating in the community. And the percentage of people who need to be immune in order to achieve this herd immunity varies with each disease. For example, herd immunity against measles requires around 95% of a population to be vaccinated. And this is related to the R naught, which is the number of people that one infected person will pass on a virus to on an average. Measles has an R naught of 15, in populations without immunity, that means on average, one person will spread measles to 15 other people. So to achieve herd immunity, we need to make sure that at least a portion of this of the population with the formula is 1 minus R over R naught. So for COVID, the R naught is around 2 to 3. For an R naught of 3, the higher end of the estimate for COVID, this means that we need to get at least 67% of the population immune.
Recently, we have seen the emergence of the Delta variant, which is much more transmissible. How will this Delta variant or other existing or future variants affect our ability to reach herd immunity?
Herd immunity should really be thought of as a gradient, a range of immunity at which we expect to see declines in transmission, but not where transmission risk ends completely and immediately after reaching a certain point. How and when we reach herd immunity will depend on several factors. The increasing transmissibility coming from more infectious variants like the Delta variant, current vaccination coverage levels, expected vaccination coverage levels based on hesitancy, natural immunity from past infections, and of course control measures and the behavior of people in the community. So if the R naught increases, then the amount of people you need vaccinated to get herd immunity also goes up. So the more transmissible variants increase the numbers we need to reach. Some experts are now estimating that the threshold for herd immunity with the Delta variant is around 80 or even 85%. But it's important to note that R naught is not a biological constant for a pathogen. It is affected by numerous biological, social, behavioral, and environmental factors that influence the pathogen's transmission.
Thank you, Dr. Sanikas. Your answers have been very informative and enlightening. Again, we thank you for being our guest speaker here today.
This ends our experts class today. We thank you for watching and we hope for your continued participation in other NRCP lectures. Good day and stay safe, everyone.